All right. Good day, good day, good day. It's the infectious doctor, Amina Goodwin Fernandez, and I have not been live or on social media at all for quite a while 6 months. I actually had to take a break. Well, I decided to take a break due to a personal issue, and now I'm back. And what better time than now when we are in the midst of this coronavirus issue, COVID-19? So everybody is asking a lot of questions. I'm getting a lot of questions. So I said, maybe now is really the time to get back online on social media and just to kind of address some of the questions. So I'm going to kind of go back to front to so the first thing, should we panic? And I made some notes to myself. Should we panic? Like, oh, is this really such a massive deal? It's all over the news, the world is coming to an end. I don't think we should panic. I don't think panic is a good thing. When you panic, you make mistakes. You are not as vigilant, and you can paradoxically put yourself at higher risk for bad things happening. So definitely panicking is not what I recommend we should do. Right. So what should we do? For for all of us, healthcare and just the general public in general, the main thing is going to be hand hygiene, just kind of keeping our hands as sanitized as possible. The regular alcohol-based hand sanitizers, at least 60% is what is recommended for sanitizing your hands. And you're going to sanitize basically whenever you touch potentially contaminated surfaces. So we in the hospital, we sanitize when we enter rooms, when we leave patients' rooms. When you touch doorknobs and you enter a floor, you probably should just put your hand and get sanitizer. And just to sort of decrease the load or the concentration of germs on your hand. And in this case, we're talking viruses, but all germs in general. If somebody's coughing, like in this time, you definitely want to kind of stay far, probably at least 6 feet or more from somebody who is actively coughing, because at this time, you're just not going to know. I'm here in Mississippi, and so far, as to my knowledge, there's no reported case of coronavirus disease in Mississippi, but it's probably just a matter of time. It's kind of slowly encroaching on us. The other states, Florida, Tennessee, and so on, they have cases. So it's probably just a matter of time. And the way this virus is spreading fast and, wide, they're not calling it a pandemic yet, but it's probably a pandemic because it's basically everywhere and spreading pretty rapidly. So, it's probably just a matter of time. So you're not, it's flu season as well, so you don't want to get the flu or any other infection for that matter. So generally speaking, it's a good idea to stay, to not be too close or close at all to coughing people, just for all reasons, but of course for coronavirus. Hand hygiene is the basic fundamental thing to do to keep yourself safe, and frequent hand hygiene, and then staying away from coughing people. But the big thing, in my opinion, I don't hear a lot of people talking about it, but I think we should go out of our way to make ourselves the strongest possible hosts. People who are in the best health are more likely to fight infections, any type of infection, and to overcome it. So us just kind of eating properly, wholesome foods, kind of eating better foods than unhealthy foods, because more kind of chemicals and so on would be more strain on your body. And if you have energy to fight an infection, so in my opinion, kind of taking care of your body as best as possible is very, very important to fighting coronavirus infection, and also to fight any infection or any infection in general. So I think that's a big one that's kind of being overlooked, that we can actually do. That's something we can actually do. We might not be able to prevent all exposures to COVID or other germs, but we can make ourselves as strong as possible to be able to fight and overcome this kind of infection. So we're in healthcare, I as a physician, infectious disease physician, and then there are a lot of nurses who are really concerned as well that we are on the front line, and we are most likely to get exposed. And then we are concerned because we have our families at home, we have children. I have a 3-year-old son. And so, what do we do? We have to come and take care of people because that's what we do. But then, what about our family at home? What do we do? So I think, again, for us in healthcare, you sanitize as much as possible, wipe down your surfaces. When we are going to be kind of paying attention, those who are in clinics and I guess in the emergency rooms, they have to be paying attention to people who could potentially be infected, if they have traveled somewhere, or if they just have symptoms, cough, shortness of breath, and fever, or just if you're suspicious, you're just going to have to kind of get those people quickly isolated. They have to put on masks and you put them away, and then kind of get the channels involved in the hospital to make sure these potential cases are tested appropriately and kind of quarantined accordingly, et cetera, et cetera. But for us in the hospital, and preventing infection or not carrying infection home, I just kind of say what I personally do. I always sanitize. I'm obsessive compulsive about hand sanitizing. Before you eat, your hand sanitize. After you leave the bathroom, your hand sanitize. But also when I'm leaving the hospital, I take off my coat because this is like a barrier, and so I take this off, and then when I leave the building, I sanitize my hands. Excuse me, I sanitize when I get into the car. And then when I get home, I take off my shoes on entering, and the first thing I do is wash my hands before I touch my son. And then I take off my clothes and so on. Now, when he was a baby, I was more strict with bathing, bathing when I got home and, before I lifted him and so on and so forth. But since he got a little bigger, I was just kind of changing my clothes. But I think from now, this week, I'm going to go back to just when I get home. Actually, from today, I'm going to start just when I get off everything, I'm going to just bathe Mississippi to our knowledge as yet. And of course, my son, I'll not let him touch my clothes, et cetera, et cetera. Now, for this coronavirus, yes, I don't think we should panic, but should we take it seriously? Absolutely, we should take it seriously because after all, it has a higher mortality rate than something like the flu or the viruses that are circulating or that we're accustomed to. So the mortality rate so far looks like maybe 2 to 3% of people, so maybe 2 to 3 persons per 100 likely possibly to die. That's preliminary information. That could change, of course. This is an evolving disease and we're still learning about it. But 2 to 3% fatality rate compared to way less than 1%. Way less than 1%. I thought my signal went for a bit. Compared to way less than 1% for, is my signal still there? Oh, I hope so. Are you all hearing me still? Can somebody maybe give a comment? I think so. Anyway, 2 to 3% fatality rate for coronavirus disease compared to way less than, people are hearing me, compared to way less than 1% for something like influenza. So, because it has a higher fatality rate, we definitely should worry about this, right? But life kind of has to go on anyway. We might be worrying so much about this because this is all the media seems to be talking about, but we have the risk for forgetting things like influenza. Now, influenza is actively being transmitted, at least in North America. Certainly in Mississippi, it seems we're getting cases every single day, and we're actually losing people still as well. One of my patients, unfortunately, died of influenza last week. Well, it was influenza, and then on top of influenza, a bad bacterial infection. But influenza is still a very serious threat. And coronavirus infection, there's no specific antiviral treatment. There's no vaccine to prevent it, but we do have things to treat and prevent influenza. We have the influenza vaccine, which, yes, it's not as effective this year, maybe 45-50% effective this year compared to previous years. But at least we know that even if it's not effective, like in preventing influenza, chances of having a more mild case of influenza it's a high chance of having a more mild case of influenza. So it still is beneficial to take the influenza vaccine. And then we have the Tamiflu just in case we do get it and we want to kind of decrease the severity of the illness. So that's kind of where both are different. Somebody had asked me, because as I said, people asking questions, the housekeeping staff, they're so concerned as well because, they have to go and kind of clean up all the messes. So obviously they're exposed as well. So one lady asked me, is this coronavirus curable? So I said, well, yeah, certainly it is curable. But, you can get a boil on your skin, a bacterial skin infection, and it's curable. It runs its course. The body takes care of it on its own. And that's the same for coronavirus. So in most people, the body's immune system will come into play and get rid of the virus, and you will be cured, right? Of course, there's medication for fever and for body aches, and then for people who have more severe illness, they might need oxygen or just further intensive care in the hospital. But it's curable in most cases, so we don't have to think that this is like completely incurable infection. HIV is something that's not curable, but there's medication for it. But this infection, coronavirus, is curable, but you might have some symptoms and you might end up in hospital before it is cured. So that's one thing. Now, let's see what else. Should we wear a mask when going out? So you see people wearing masks like everywhere. My mother was traveling, and there are people in the airports wearing masks, and some of them are wearing these, I don't know, hazmat masks or whatever. But do we need to wear masks when we're out and about? And the answer to that is actually no. So a lot of people are wearing these surgical masks, these kind of thin masks that we wear in the hospital around people with the flu and so on. And those masks are only good for 20 minutes. So if you're wearing a mask like that, it has to be changed every 20 minutes, because the fact is these masks get moist from breathing and talking and so on and so forth. So that gives moisture to the mask. And then moisture is what these germs, like viruses, they thrive on moisture that promotes multiplication. And so you're going to end up getting the virus kind of multiplying on your mask. And then you're going to be fiddling and touching the mask because it's uncomfortable. And then you'll kind of touch your eyes or whatever. And so you're probably going to increase your risk for getting infection if you're wearing these surgical masks. And then you get a false sense of security with the mask. You're going to feel like, oh, I'm good now. And so you're going to probably forget that you have to sanitize your hands and so on and so forth. So no to the masks. So some people are probably thinking, like, should we restrict our activities? Like, should we just, I don't know, stay locked up at home? And that's probably just not practical. I mean, most of us, we need to go to work anyway. And, you need to go to the supermarket. And life sort of has to carry on. So you just do what you have to do, but be vigilant. Always have hand sanitizer in your handbag, probably clipped on the outside so you're not putting your hands in your bag to touch and fiddle around to get the sanitizer. So have it clipped on the outside, and you just able to open it, squirt some in your hand, a generous amount, and rub your hands between your fingers and, get it on your nails, depending on how soiled your hands are. And so just keep your hands clean. When we're out, like if we have, go to a restaurant or whatever, we might not go as often, but if we go to a restaurant, I always have wipes since my son was a baby. So I always have wipes, and I just wipe down the place. And I've been doing that from ever since. And sometimes people might look and think, what's up with her? Like, why? But I think more than ever, that's going to be pretty important to just kind of make sure you wipe down surfaces. In restaurants, the tables are so dirty. Even though they clean them, they're always dirty. And so I always clean off the table, especially because I know my son's going to be all over the table. And so we'll keep doing that. And, traveling, I'm supposed to probably take an international trip, and I'm just going to carry lots of wipes, wipe down like a crazy woman, wipe down the plane window because Aaron is going to be touching it up, wipe down the table for the plane, wipe down the seat, wipe down the buckle, basically just wipe everything. They talk about, for this virus, for transmission, they say it's mainly droplets, people coughing, on you, I guess, coughing within 6 feet of you. So it's mostly the droplets. It's not clear how much contaminated surfaces contribute to infection, but I feel like if somebody's like coughing, they were in an area, you're not sure, you don't know you're there, and they were right there coughing. And so droplets could be all over the place. And so I think that touching contaminated surfaces can contribute to infection. And so that's why I'm planning to wipe down wherever we will be for prolonged periods of time to just decrease the chance of transmission. Going in and out of buildings, some buildings don't have automatic doors, so usually I would elbow the door, to open it. And but if the door has to be opened with your hand, then have the hand sanitizer to kind of squirt and clean off your hands. But basically, it's gonna be mainly for just us and everybody in general, even in hospital, but everybody. It's just keeping your hands clean, because all of us, like subconsciously or unconsciously, we would touch our mouths, kind of rub the nose, rub the eyes. So it's subconscious things. And as much as like I might feel like I'm a germaphobe, I know that sometimes I might kind of touch these places. And so those are entry points for the infection. So that's like kind of what I wanted to say, just in terms of allaying fears. The fact that, life has to go on. Panic doesn't help. In fact, panic might make things worse, because you're more prone to messing up and making mistakes. I think most importantly is to keep yourself as healthy as possible so that you're the strongest possible host to fight this infection. Um, Maybe I can do another live, because this might be going a bit long. But basically, in terms of the coronavirus infection, I mean, what is it anyway? Coronaviruses, it's basically a large family of viruses. These viruses, they're common in humans. Um, the common cold is caused by a coronavirus, and there are many of them. They're in humans. They're present in animal species as well. And rarely, though, the animal coronaviruses can actually transfer over to humans and infect humans. And then they may spread between people, such as we had with SARS in like 2004, and then MERS in about 2013-14. And that's what they feel is the case with COVID-19. COVID-19 is coronavirus disease 2019. And it's caused by severe acute respiratory syndrome coronavirus 2, because that's like the second one. SARS in 2003 was coronavirus 1. Anyway, so it's animal. Started in China, maybe in a fish market in Wuhan. So, but they're still trying to figure out where this virus came from. It probably came from some kind of animal. And it's transmitted by droplets. So from coughing and sneezing and all, whatever you cough or sputter out, those have the virus. The thing with this virus is that a lot of people a lot of people have mild infection, maybe like a simple cold. And some people, especially children, apparently can have no symptoms whatsoever, or children might just have a fever for a little while. And so people can kind of have mild illness and not know, so they don't realize they're infectious. And that's probably why, it's spreading so rapidly, right? So droplets, they're not sure about surfaces, but personally, I believe that you can probably get it from surfaces. If somebody who's infectious is coughing, and dropping germs everywhere. So that's basically the symptoms. They say fever, cough, shortness of breath. Those are the big ones. But now we're realizing, or they're realizing, the people studying the cases are realizing that not everybody has fever, and they're not sure yet if the fever is continuous or if it's episodic, like you have fever and none, and so on and so forth. So they're still trying to elucidate, like, actually how people present, right? So, and then, younger people, like, they might have fever, but anyway, they just don't know, like, who is going to have fever, who is not going to have fever, but younger people might not have. Now, the older people, they're the ones, like older persons, elderly people, or frail people, or people with multiple medical problems, they're the ones who are more prone to more serious disease. So 80% of cases are mild, maybe 20% are more serious, and, with some of those having to go to the hospital and be in the intensive care unit. And seriousness happens when somebody actually gets pneumonia, and like severe pneumonia involving both lungs, and sometimes they have to end up on the ventilator. The incubation, like, you can be exposed today and 2 days later you get symptoms yourself, or up to 14 days later, so up to 2 weeks later. And so that's why in the media they're talking about quarantining people who have been exposed for 14 days. So that's that. Somebody who is on quarantine, they basically have to be at home, not leaving, and the health departments usually are the ones who are supposed to be monitoring these people and giving permission to return to regular daily activities. And now they're testing. Testing is more available, and so on and so forth. But as we said, treatment is just supportive care, keeping hydrated. If you have an appetite, eating nourishing foods, fruits and vegetables, and other good foods, and just staying positive and hoping and praying for the best, I suppose. So that is my little presentation back on social media, and I hope everybody just stay safe. Do the basics. Eat healthily, take care of your health, keep yourself strong. And people, a lot of people, even us in healthcare, we have our own chronic medical problems as well. Diabetes, maybe some people have a bit of heart failure. And if you have these chronic conditions, now is the time to really pay attention and focus on on optimizing them if they're not optimized. If your sugar's in the hundreds all the time, like now is the time to say, okay, I need to do something, because if and when I should say coronavirus gets in my area, I want to be one of those who's strong enough to eradicate it. So that is it, and I hope everybody stays safe this weekend. And I guess every day we keep up to date with what the CDC has to say about this. And thank you all for watching. And see your own doctor, obviously, for specific advice or recommendations related to you, because I just give general advice here, not specific advice to everybody else. So you all have a good weekend. Be safe. Have sanitizer around and eat properly. All right. Bye.